Is it going? Okay. This is Valerie, Griffin, and Dan. Starting the physical assessment. I apologize for the cats. When we lock them out, they just cry at the door and it ruins the audio. So we're just using them as therapy cats right now. I have thoroughly washed my hands so that I'm ready for the assessment. I have my tools on the floor to the left of the computer here that I will refer to when they're needed. And also to start, we went ahead and took a blanket example of Dan's vital signs. Temperature 98.6, blood pressure 120/80, heart rate 65, respiratory 16 at rest, and pulse oximetry 98% on room air. Okie doke. So let's get started here. Okay. I'm going to go ahead and inspect Dan's head here. We're going to look at his hair, which is clean and dry, and then also his skull, which appears to be symmetrical, and then his face, which appears to be symmetrical as well. I'm going to go ahead and palpate Dan's skull, and I'm going to feel the forward and the sides and the back, and it feels normal cephalic. Alright, also, I'm going to go ahead and palpate his temporal sinus and his maxillary sinuses. Dan, please tell me if you have any tenderness. Any tenderness?
No.
No tenderness noted. Okay, so now I'm going to go ahead and palpate his temporal artery here on his head, on each side. I don't feel any thrill, and 2+ as expected. I'm also going to go ahead and get behind Dan for a moment and palpate his thyroid. I'm going to deviate from right to left and feel for any nods or masses, and any nodules or masses on this side as well. Any pain upon the assessment?
No.
Perfect. Okay, I'm going to have you open and close your jaw here. And any pain?
No.
No clicks, cracks, or crepitus? Okay, we're going to go ahead and move on to looking at Dan's eyes. For this, I'm going to go ahead and inspect the eyes and look at his sclera, which is white. And then also, with my clean hands, I'm going to pull down on his lower lids and look at his conjunctiva, which is pink and moist and has no drainage. I'm also going to go ahead and start my extraocular movements here. Dan, will you follow my finger up and to the left, back into the center, straight to the left, back into the center, down to the left, back to the center, up into the right, back to the center, straight to the right, back to the center, down to the right, back to the center. Thank you. So their cranial nerves 3, 4, and 6 are intact, and also there is no convergence noted. Okay, I'm going to go ahead and test Dan's peripheral vision. Go ahead and look straight ahead at the camera here. How many fingers do you see?
2.
And then on this side as well, how many fingers do you see?
2.
Alright, peripheral vision intact. Now I'm going to go ahead and get my handy dandy ophthalmoscope. For all intents and purposes, this is going to act as my ophthalmoscope. What I'm going to do is go ahead, Dan, please look straight ahead. I'm going to look at his retina, and his fundus is nice and clear with no abnormalities. And then same on the left side. Fundus is nice and clear with no abnormalities. Also, disc margins are nice and sharp on the left, and disc margins are nice and sharp on the right. Now I'm going to go ahead and explain here, since we do not have a Snellen chart, how I would normally do this is he would stand on a line that's 20 feet away from a wall that has the Snellen chart that's got the big E at the top, and he would read through consecutively the lines that he could see most clearly. And on the edges of the Snellen chart will have a numerical value. Now Dan said he did go to the optometrist this year. Dan, what was your visual acuity?
20 out of 20.
Perfect. For both eyes?
Yes.
Of course. Alright, so I'm going to hold on to the ophthalmoscope. I'm going to take a look at his ears. I'm going to start over here with the right. The right auricle is nice and pink. And now let's look into the ear canal, which is pink and moist. And then the tympanic membrane, which is a pearly gray. And on the right side, it is in a 5 o'clock position with this cone of light and no drainage noted. Now I'm going to go ahead and look at the left. Look at the left ear auricle is nice and pink. Take a look into the ear canal, which is nice and pink as well. And then the tympanic membrane is a pearly gray, and the cone of light is in a 7 o'clock position with no abnormalities noted. All right, still holding on to our ophthalmoscope. Actually, we're going to go ahead and switch. We're going to test his hearing. We're going to get our fork. We're going to start with the Weber test. Okay, Dan, let me know when you can hear the ringing.
I can hear it. Stop.
Perfect. So no sensory, neural, or conductive loss. Now I'm going to do the same thing with the right behind the ear for the rhyme test.
Can hear it. Stop.
All right. Perfect. And then over to the left.
Can hear it. Stop.
Perfect. So no conductive loss. I'm going to put this down now. This is going to stand off to the side and do the whisper test.
Blue, coin, pepper.
All right, perfect. I'm going to go ahead and grab the ophthalmoscope and take a look inside Dan's nose. If you could just tilt your head back a little bit. I'm going to take a look in the right near and the left near. And the nasal cavities are nice, pink, and moist. And the turbinates on both sides are nice and patent. I'm going to continue to hold on to our ophthalmoscope. I'm going to take a look inside his mouth here. If you can open your mouth nice and wide. Okay. I'm taking a look. All right. So tonsils are 2+. There are no lesions inside the mouth. The oropharynx is nice and smooth. And no postnasal drip noted. Perfect. All right. Let's go ahead and put that down. Okie doke. Now, one thing before I forget for our eyes again is we should test his perla. Go ahead and look straight forward. I'm going to come over to your left. Look straight forward. To the right. Look straight forward. And one more time. Straight forward. And again to the right. Straight forward. Alright, pupils are equal, round, and reactive to light and accommodation. I wanted to make sure we fit that in before we start to go to other areas of the body. Okay, and that is also important to consider, and our cranial nerve 2 is intact with pupils that are able to constrict and accommodate to light. Alright, moving on, we're now going ahead, I'm going to take a look at his neck here. It is nice and symmetrical, with no discoloration. Perfect. All right, now it's time to palpate. Let's start with our lymph nodes. We have the preauricular, the postauricular, the occipital, submandibular, submental, then tonsillar, superficial cervical, the deep cervical chain, posterior cervical chain, if you could hunch a little forward, and then supraclavicular. Any pain or tenderness when I palpated?
No.
Did not feel any of the lymph nodes as well, so that is nice, normal, and intact. Okay, now to explain the gag reflex. I will not be putting a tongue blade or a cotton tip applicator in the back of Dan's throat just for his own comfort and safety. But how I would do that is I would go through the patient's mouth, gently tap the back of the throat and see them go ahead and have a gag reflex that way. Moving on, we're going to do respiratory. Let me go ahead and grab my stethoscope. Okay. First, I'm just going to observe Dan. I see that he has symmetrical chest rise and fall that is spontaneous in nature. So I'm going to go ahead and get behind him here. And I'm going to go ahead and auscultate his lung fields in 10 places. Every time I move my stethoscope, take a breath in and out. Perfect. He had air sounds in all of his lung fields that were clear in nature. Now we're going to do a little bit of bronchophony. Every time you feel me move the stethoscope, I want you to say the word 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, nice and negative for bronchophony. All right, so now I'm going to do a little bit of tactile fermentis. I'm going to go ahead and touch, and I want you to say that same word, 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, vibration is felt evenly and throughout all of the lung fields here. Now I'm going to go ahead and do a little bit of percussion as well. You're going to feel me tapping? Okay. Now to check his chest expansion, I'm going to butterfly my hands behind his back and watch his chest rise and fall to see if my hands will butterfly nice and equally. I'm going to have you lean forward just a little bit. I'm going to go to the mid of your back and go ahead and take a nice deep breath in and out. Equal chest expansion. I had a beautiful equal butterfly. Okay. Oh. Costal-vertebral angle. We're going to go right by the kidneys on the left and the right, and I'm going to do a little bit of a hammer hand, see if that vibration causes any pain or discomfort. On the left? Any pain or discomfort?
No.
On the right? Any pain or discomfort?
No.
Okay. All right. Now let's start with the, let me put this down. They're cardiovascular. I'm going to look for, go ahead and straight ahead, look for any jugular venous distension that would be 4 centimeters above the sternal angle. And he has negative jugular venous distension on each side. And now I'm going to go ahead and take a look at your hands here, Dan, and your fingernails. So, sorry. So hands are symmetrical and fingernails are symmetrical. I'm just going to check the capillary refill very quickly as well. Alright, cap refill is brisk throughout all fingernails. Okay, let's go ahead and take a look at your lower extremities here. I'm just going to angle down a little bit. Alright, so lower extremities are equal bilaterally, no abnormal findings, no edema. Feet and toes are the same bilaterally. I'm going to go ahead and check the peripheral vascular in each toe with cap refill. Okay. Alright, cap refill is less than 3 seconds, and pause without. Now that I've touched his feet, I'm just going to go ahead and spray some hand sanitizer on. Okay. Might be, watch out. Okay. All right. Let me see. Let me see you. Okay. Now I'm going to go ahead and listen to his arteries here, looking for any bruits and expected sound. So let me go ahead and take my stethoscope. I'm going to start with the temporal artery on the bell side. Same on the bell side. And then on the diaphragm side. No temporal artery bruits heard. And we'll start with the bell side for his carotid. On the left. And switch. No bruits heard at bilateral carotids. I'm going to go ahead and take a listen to the heart here. Dan has a clear S1 and S2 with no adventitious heart sounds. Okay, I'm going to have you lay down here. Just lay next to him. Just lay next to him. It's fine. He'll be fine. Okay. See your hands? I'm going to go ahead and take a listen to his abdominal aorta as well. And on the bell side, no gray hair. Listen to his renal arteries, the diaphragm, and the bell side. No bruise auscultated, and his iliac arteries. And on the bell side. No bruise appreciated, and now his femoral arteries. Alright, no bruise appreciated on either side. Okay, now we're going to go ahead, I'm going to have you sit back up at the edge of the bed again here, Dan. Is we're going to go ahead and palpate all of those. So I'm going to start with the temporals up at the top. Alright, go on the right. So now I'm feeling for a thrill, and a 2+ is an expected pulsation. So right now it is no thrill and 2+ on the right. No thrill and 2+ on the left temporal. Let's check the carotids on the right. No thrill and a 2+ on the right carotid. No thrill and a 2+ on the left carotid. Let's go ahead and start with the brachial. No thrill and 2+ on the right brachial artery. Let me go ahead and feel on the left. No thrill and 2+ on the left brachial artery. Let me go down to the left radial artery. No thrill and a 2+ on the left radial artery. And then let's go to the right radial artery. No thrill and a 2+ on the right radial artery. Now I'm going to go ahead and check for PMI, which is going to be the midclavicular line at the 5th intercostal rib. And it is present, brisk, and tapping, and no greater than 3 centimeters. Okay, I'm going to have you lay flat again. He'll be fine. He did fine this time. And I'm going to feel for the femoral arteries here. On the right, it is brisk and 2+ with no thrill. Well, it is normal 2+ and no thrill on the left. Normal 2+ and no thrill. And now I'm going to go ahead towards the knees here for the popliteals. Let me just do that. I'm sorry, I sat on your hand. The right popliteal artery is a 2+ and no thrill. Let's check the left. It is a 2+ and no thrill on the left. And then the posterior tibial artery on the right is a 2+ and no thrill, and then the posterior tibial artery on the left is a 2+ and no thrill, and then the right dorsalis pedis artery is a 2+ and no thrill, and the left dorsalis pedis artery is a 2+ and no thrill. Okay. Now, to talk about 2 tests, let me grab them here. If we wanted to know his ankle brachial index, we would take, for each foot that we would be looking on, we would take like the right side, the highest systolic blood pressure of the right foot divided by the highest systolic blood pressure of the right arm. So we did this for Dan, and he is 120 over 120, which is 1.0, so he has a normal ankle brachial index. I would also go ahead during this cardiovascular assessment, check his 12-lead EKG. So where we put that, we put it on a right upper extremity and a lower extremity on each side, and then I would put the V1, V2, V3, 4, 5, 6 on each side. He would lay still for 10 seconds. We would go ahead and let this read, and I would hand it off to the physician. But he has normal systolic rhythm. Perfect. All right. Now we are moving on to, you're in a good position right now, Dan, because now we're going to do GI. So let's check his skin turgor, which is, he's not tenting. I'll take a look at his abdomen, which is, I can take a look, because they're symmetrical and flat. And now I would take a listen here as well to all 4 of his quadrants for his vowel sounds. All right. Vowel sounds are normal, active. Now let's go ahead and do a little bit of percussion here in all 4 quadrants first. So we're going to go ahead and listen. All 4 quadrants are tympanic with no dullness. Now I'm going to go ahead and percuss for the spleen, which is on the left side, the left upper quadrant underneath the rib. The spleen is tympanic. Now let's go ahead and find his liver here, which is going to be on the right upper quadrant by the ribs. So let's start. Has a bit of dullness between 6 and 12 centimeters, which is a normal sized liver. Okay, now let's go ahead and do a little bit of light palpation. So you're going to feel me kind of touch here. Let me know if you have any tenderness, Dan. Any tenderness? No. So no pain upon light palpation. Now we're going to do some deep palpation and check for masses. All right. So no masses were palpated during deep palpation. All right. Now we're going to go ahead and move on to feeling for your liver, spleen, and then the kidneys. So first the liver. So I push up. I can feel his liver up here. For his spleen, it's pretty far underneath that rib, and his spleen is not being able to palpate. Let me feel for the kidneys. I cannot feel either one of his kidneys as well, which is a normal finding. Okay, now we're going to do musculoskeletal. So I'm going to go ahead and have you sit at the edge of the bed here, Dan. And I'm going to take a look at his shoulders here, which are nice and symmetrical throughout. Go ahead and put your arms out like a zombie. All right, arms are nice and symmetrical bilaterally with no abnormalities. Take a look at the wrists, are symmetrical bilaterally with no abnormalities. Same with the hands, are symmetrical bilaterally with no abnormalities, and the fingernails are symmetrical with no abnormalities. All right, I'm going to take a look at your hips here. Can you stand straight up? All right, hips are symmetrical with no abnormalities. And now looking at the thighs, I can see they're symmetrical with no abnormalities. Oh, sorry. And then, thank you. The lower extremities, the knees, are symmetrical with no abnormalities. And also the ankles are symmetrical with no abnormalities. Note there is no edema or swelling. And the feet are symmetrical with no abnormalities, along with the toes are symmetrical with no abnormalities and have expected ankle curvature. So go ahead, we're going to test your range of motion. Let me go ahead. We're going to test his range of motion. Go ahead and take a seat again. For your head, I want you to watch me on the side. All right, you're going to go ahead and tuck your chin toward your chest. Look back toward the ceiling. For your extension, flexion is normal, extension normal. Go ahead and bring your right ear to right shoulder, left ear to left shoulder. And then lateral movement is normal, and then rotate your head to the right and the head to the left. Rotation is normal. Okay, shoulders. I want you to go ahead and shrug them up high. Bring your arms up. All right. Extension and then flexion is normal. And then I want you to go ahead and do the back scratch test. Take your right arm behind your back. Left arm behind it like you're trying to touch, and then go ahead and switch sides. So adduction is normal as well for his shoulders. All right, elbows. I want you to go ahead and have your elbows out in a pronation position, like you're serving pies, and then go ahead and do a bicep curl. All right, flexion is normal and extension back out is normal. So we have supination. I want you to go ahead and throw those pies on the ground for pronation, which is normal. Perfect. All right, wrists. I want you to go ahead and flex them down, and then go ahead and extend them up, and then put them in the neutral position again. I want you to radial pronate them in, deviate them in, and ulnar deviation outward. All right, all of those movements were normal for your wrist. Thank you, Dan. Now the spine. I'm going to have you stand up. I'm going to have you go ahead and reach your toes. All right, flexion is normal. Stand up straight. And I'm going to have you kind of lean back a little bit. Extension is normal. Perfect. Stand straight. And now I'm going to have you kind of bend side to side. Hands on hip side. All right, lateral extension, lateral movements are normal. And now I'm going to have you keep your hands on your hips and then twist. From right is normal rotation, left has normal rotation. Perfect. All right, so the hips here. I'm going to have you kind of kick, maybe go this way so we can see your hips. Go ahead and mimic my movements. Bring your hip straight out, and then back, and then maybe stand to the side. Go ahead and flamingo it backwards, just normal. Go ahead and stand neutral, and then same with that left leg. And then extension is normal, flexion is normal for that left hip as well as the right. Go ahead and stand neutral. Okay, perfect. Now we're going to have you go ahead and do the knee. So the knee, I want you to kick that flamingo leg up, and then back to neutral, just from the knee. Flamingo leg up on the left for flexion, which is normal, same as the right, which was normal. All right, I'm going to have you sit at the edge of the bed here again. Perfect. Okay, and then from here, it's much easier for me to check your knee extension because you can sit and then just from the knee, kick it out. Left, the extension is normal, and then with the right, extension is normal. All right, now we're going to do the ankles. I'm going to lower this camera down just a little further. So I'm going to have you go ahead and deviate them inward and outward. Both are normal. And then go ahead, we're going to do the, you're going to push your foot down like a car pedal, and then peel them backwards. Extension and flexion of the ankles are normal. I think it's the posterior radialis. It's normal. Okay. Now we're going to go ahead with testing the strength. So we're going to start with the head. A 5+ is movement against resistance without fatigue. So if I say a 5, that is a normal finding. Go ahead and push against my hand here. That's a 5, and back is a 5, to the side, 5, to the other side, 5. Perfect. So his neck here ranks as a 5. All right, push against my resistance, shrugging your shoulders upward. Shoulders rank as a 5. All right, now we're going to go ahead and do the elbows. I'm going to have you serving pies again. Go ahead and push up against my resistance. All right, nice and 5. And then push against my resistance here, nice and 5. Now with the wrist, I'm going to have you do a stop position like at a stoplight. Go ahead and push against my fingers. That is a 5. And now go ahead and pull up against my hands here. Nice and 5 for wrists as well. Now hand strength, we're going to do this a little different. We're going to go ahead, take my 2 fingers and squeeze them with equal strength. It is a 5. All right, now we're going to go ahead and do your hips. I'm going to have you lay on your side here, Dan. You're almost done, I'm sorry. Go ahead and lift against your hips here, against my resistance. Nice and 5. Go ahead and roll and face the wall. He's fine. Against here. Nice, and a 5. All right, go ahead and sit in neutral position at the edge of the bed here. Now knees, I'm gonna go ahead and hold resistance here. Go ahead and lift your right, ooh, thank you. Go ahead and lift your right knee up, like marching.
Okay.
That's a 5, and then same with the left, and a 5. Okay, now we're gonna do the ankles. Go ahead and push on my hand like a car pedal. Go ahead and push down, 5, and push up, pull up, 5. Same with the left, push down, 5, and pull up, and a 5. Perfect. All right. This portion will go rather quickly, Dan. All right, so this is the nervous system. We're going to ask you 3 questions. Can you tell me your name?
Dan Griffin.
Can you tell me today's date?
January 3rd.
Perfect. Do you know where you are?
Yes, I'm at home in your office.
Okay. So now we're going to check abstract thinking. What do a banana and an orange have in common?
They're both fruit.
Okay. And then also, due to participants' negative feelings about counting down by 100 of serial 7s, we're going to have him count down by 5s from 100. Dan, could you go ahead and count down by 5s from 100?
Yes, thank you. 100, 95, 90, 85, 80, 75, 70, 65, 60, 55, 50, 45, 40, 35, 30, 25, 20, 15, 10, 5, and 0.
Thank you very much, Dan. All right, now we're going to test your comprehension. Could you go ahead and shut your eyes? And then stick out your tongue and touch your nose. All right, good comprehension. Now judgment. I'm going to ask you, if you found a letter on the ground and it was addressed and stamped, what would you do?
I would mail it.
Yes, good judgment. All right, so memory. Let's test your remote memory. Who was the first president of the United States?
George Washington.
Now your immediate memory. What is the current year?
Ooh, 2018.
Perfect. Dan, during that whisper test, what were the 3 words I told you to remember for the new learning?
Blue, coin, pepper.
That is correct. All right, so good new learning. So my observations of your vocabulary is that it is 1, appropriate for his age, and 2, appropriate for his education level. And then also for his articulation, it is perfect for your expression, and you have no problems formulating and articulating your words. Okay, so now we're going to kind of go and test your deep tendon reflexes, okay? I don't have that little mini hammer. I have a little hammer. We're going to go ahead and test your Achilles tendon here. I lied. Your tricep. So I'm going to go ahead, kind of like a scarecrow arm. All right. And a 2+ is an expected reflex. 2+ on the right tricep. And then 2+ on the left tricep. Let's do your bicep here on your left bicep. Go ahead and 2+ on the left bicep, and now on your right bicep. 2+ on the right bicep. Now we're going to go ahead and do the brachioradialis. So let me go ahead, 2+ on the right brachioradialis, and now on the left. 2+ on the left brachioradialis. Now let's do the patellar tendon. Down a little bit. Go ahead and uncross your legs real quick. So let's do the patellar tendon on the left, 2+ unexpected, and now on the right, 2+ unexpected. Dan, I'm going to have you lay on the bed here. I'm going to check your Achilles tendon. Go ahead and roll over on your tummy, closest to the top. Okay, so I'm going to go ahead and check his left Achilles tendon, which is 2+ unexpected, and his right Achilles tendon, which is 2+ unexpected. Go ahead and sit again at a neutral position. I'm going to go ahead and put our hammer down. Bring this over here. because I'll need it shortly. Okie doke. We're almost done. All right, so now we're going to do cranial nerves. I'm going to have you go ahead and close your eyes, Dan. So I'm going to have Dan smell a scent here, which is this. Dan, what do you smell?
Orange peel.
It is orange essential oils. So his cranial nerve 1 olfactory is intact. So cranial nerve 2, what we discussed earlier, was his pupil reflexes, and we did his perla, and he had positive perla. So he's good to go there. Also earlier we checked his cranial nerves 3, 4, and 6 were his extraocular movements as well, and they were smooth and intact. So we're going to go ahead and do 5, which is facial sensation, which I'm going to go ahead and close your eyes. Tell me if you feel same or different on each side.
Same.
All right, can you open and close your jaw? All right, cranial nerve 5 is intact. So we'll go ahead and go to cranial nerve 7, which is facial movements. I'm going to have you give me a big smile, show me your teeth, then raise your eyebrows up, and then frown really sad. So cranial nerve 7 is intact. Cranial nerve 8 is your auditory, your hearing, and we did that with the Rhine and the Weber test, so that was nice and intact. Now cranial nerve 9 is swallowing. Can you give me a big exaggerated swallow? Cranial nerve 10 is that gag reflex, which we explained earlier that I wasn't going to do, but we go ahead and take a tongue blade and touch the back of Dan's throat. All right, give me a nice shoulder shrug for cranial nerve 11. Perfect. Now cranial nerve 12, go ahead and stick your tongue out of your mouth. Now that is nice midline and symmetric. So all of his cranial nerves 1 through 12 are nice and intact. Let's go ahead and test your coordination here. All right, take your right hand, one finger, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. Then same with your left hand. Go ahead and touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. All right, perfect. Nice, smooth, and intact. Now let's go ahead and I'm going to have you lay back down and do the heel to shin test. He'll be fine. Take your right leg over to your left knee and slide it all the way down and back up again. You can go faster. And that's nice, smooth, with no jerking. And same with the left. Perfect. Heel to shin test is intact. Nice, smooth, no jerking. Go ahead and take a seat at the left here. All right. So now we're going to do the alternating rapid hands test. So I'm going to have you put your hands on your thighs here. Face down. Oh. Face down. Face up again. Face down. Face up again. All right. Nice and intact for rapid alternating hands. So now I'm going to have you do the Romberg's test, which is the DUI test, Dan. So I'm going to have you walk on a straight line heel to toe. Go ahead. All right. Gait is steady with continuous symmetric movements. Okay, take a seat. We are in the last leg of it, ladies and gentlemen and cats. All right. I'm going to have you close your eyes now. Go ahead and hold out your hand. I'm going to test the graphesthesia. What shape am I drawing in your hand?
Circle.
That is correct. Positive graphesthesia. Now, this is going to take just a little bit longer. I'm going to touch you with something soft, which is dull and sharp. Okay? Tell me what you feel.
Soft. 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 Dull. 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 Sharp. 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 Sharp.
All right, so bilateral upper extremities have positive sensation, proximally and distally. All right, I'm going to do the same thing with your legs. You can kind of scoot your butt all the way back to the headboard there, straight back. Go ahead and keep your eyes shut again, so I can see it nice and easy. Okay, same thing.
Soft. soft, 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 dull, 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 sharp, 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 sharp.
All right. So lower extremities, bilateral lower extremities have positive sensation, both proximal and distal. And now feet.
Soft, soft, dull, dull, sharp, sharp.
Babinski. So expected sensation in his feet as well. All right. I'm going to go ahead and have you open your eyes, come back to the neutral position up here. Fold your hands. And I'm going to touch one of your fingers. Which finger am I touching? Don't look.
Ring finger.
That is correct. So positive position sense. And the last test is we're going to do is stereogenosis. Stereogenosis. All right, keep your eyes shut. Thank you. All right. I'm going to have 3 objects. Can you open your hand? What did I place in your hand?
A key.
That is correct. All right, next one. What did I place in your hand?
Coin.
That is correct. And then last but not least,
Paperclip.
thank you. And thank you for enduring the physical assessment. He is positive for feeling all the objects in his hand is genosis. And Marty has successfully slept through the entire assessment. Thank you very much. Have a great day.